it's Dr. Amy, and it's time for another Tuesday tip. So this month, we're talking about MTHFR and migraines, and also some other gene SNPs that may play into this process. Now, migraines with auras are far, far more common in women, and of course, as with everything else in women, one of the factors here is hormones. Now, many women will have significant association between their migraines and their menstrual cycle. And so for a lot of women, migraines start around puberty when their menses are starting, right? That's their first onset of migraines as well. And also for a lot of women, migraines repeat either monthly or bi-monthly on a pretty common pattern. The most common time for women to have migraines is actually when estrogen levels are falling sharply. And so very often that's a premenstrual migraine. But some women will have them after ovulation or in both instances, and some women don't follow that typical pattern and have them at a different point in their cycle reliably, right? And so, at this, whatever their spot in their cycle is, they can kind of predict it every month. It's going to happen the same way. And so what that means is that doing things to help to even out some of those hormone shifts and make them a little bit less drastic can actually help to control this type of migraine. So one of my favorite tools is seed cycling. Now, seed cycling is the use of 4 different types of nutritive seeds, right? Like just seeds you would eat with food. And those are flax, sunflower, sesame, and pumpkin. And using these seeds has really high lignin content. Lignins do help to bind and control excess estrogens, and it also has nutrients that support both progesterone and testosterone. And so by varying these seeds through the cycle, what we see is this really gentle sort of hormone curve where we're not getting those super high highs or super low lows. And that's what we want, really, right? We want to kind of keep it even-keeled, predictable, whatever. And by doing that, we can see some migraine prevention. But also, research is delving into ways to actually use extra doses of external estrogen, right, like a bioidentical estrogen or whatever, to actually mitigate hormone-related migraines when they start. So just remember with this that hormones can be a factor. And what that means is other hormone-related gene SNPs are also a factor. So COMT gene SNPs very often also have a higher incidence of migraines. Also ESR1, which is estrogen receptor 1 gene SNPs, can have a higher incidence of hormonally related migraines. And PSR, which is progesterone receptor, those can also have higher risk of hormone-related migraines. So, of course, there's lots of genes at play here, but the bottom line is hormones can influence migraines, and so influencing hormones can make your migraines less. We'll work on that. Okay, bye guys.